It's my pleasure to welcome you to the celebration of the Jameel Institute's first anniversary and this exciting symposium shaping the post-COVID-19 world.
I'm delighted to join you today on behalf of Community Jameel as we come together to mark this important milestone for the Jameel Institute.
Imperial College London was combining its amazing academic strength with a world-leading foundation, Community Jameel.
Can you tell us a little bit about J-IDEA?
So the founding of J-IDEA really built on our experience in the last 10, 15 years in responding to emerging infectious disease epidemics with partners. And we wanted to go further and do what we were doing in a better, more coherent, integrated way. So we have three pillars to J-IDEA. One is the application of novel data analytics to really enabling better, more efficient and more rapid responses to health emergencies around the world. We're, of course, living through one of those today in the COVID pandemic. The second is in helping to reinforce health systems around the world. The biggest predictor of how well a country responds to a health crisis is the strength of their health system, but also health systems underpin population health more generally. And we can only do this in partnerships. So the third pillar is about building better partnerships, both with public health agencies like the World Health Organization, but also with individual governments around the world and with other academic institutions.
Little did we know that the world would so quickly be turned upside down by an emergency of epic proportions.
We now have produced a total of some 37 scientific reports, multiple papers, also advised governments around the world.
Thanks to you and all the work that's been done by the Jameel Institute as well. It's a great organisation.
Thank you. It has been remarkable how the global scientific community has come together in this epidemic.
And in a fast-moving epidemic, if you delay, even by days, then you're playing catch-up.
Too much of a focus on fairly nominal surveillance of, for instance, travellers coming into the country on the basis of let's wait and see what happens, and not standing up systematic surveillance within our countries.
And if we think of the challenges of the 21st century, they will almost all be transnational, they'll almost all be trans-regional, and many will be global.
Too often the world and individual countries have made policy largely in a vacuum.
If we don't have those international structures in place, we will not be able to respond. The fruits of biomedical science to deliver the diagnostics, the surveillance, the health systems, but also the treatment and the vaccines. Because if you don't have that collection of bullets, then you're left with effectively 19th century interventions. Whilst I'm not suggesting for a second that a vaccine is a magic bullet that will answer everything, it will be a hugely important part of how we both prevent this reverberating pandemic of now, but also how we address potential epidemics and pandemics of the future.
To give the best scientific advice on what we know about a new threat, and it might be a virus, it might be climate change, and say these are the policy options available to us. And then it is for policymakers to choose between those options.
And we've seen in this crisis how science has moved forward so incredibly rapidly and in such exciting ways.
There, the lateral flow assays have the huge advantage of getting test results back in minutes and not in days. RNA-based vaccines has been highlighted for the last few years, but often industry is quite risk averse at taking on new technologies, and I think this has really jump-started what is a very exciting new vaccine technology.
For access to transparent data, they know that the vaccines are safe and they know they're effective, and they can trust the regulators to be politically independent. This is with us to stay, and like many other infections, we need to learn both to deal with it, have the interventions that matter, but also go about life in a normal way. And I hope in 2021 we'll start to see that with the interventions that are coming.
This session, we are joined by three distinguished economists to discuss the short, mid and long-term economic and social impacts of COVID.
If the economic outcomes are really terrible, then health outcome will follow.
It's simply not the case that the lockdown is going to dictate whether people are going to spend a lot and whether GDP is going to be high or low. The lockdown is itself an outcome from the fact of the worry about the growing infection rate.
These lockdowns in developing countries have had consequences which are often much, much worse than what they have been in rich countries.
The world as a whole has deployed $12 trillion in fiscal stimulus or fiscal support measures to deal with this crisis. But if you look at the distribution of that across countries, it's overwhelmingly in advanced economies. So
one of the problems with our social welfare system, which we've seen in full display during the COVID era, is that they are built to exclude.
We've shifted from saying blanket, bring down spending or raise revenues, but being much more specific about make sure that you're protecting the most vulnerable.
Maybe we know a little bit less about how in the modern economy, and an economy with artificial intelligence, in an economy with growing digitalization, how the sort of future will pan out in terms of what sort of support and employment there might be, especially for low-skilled workers.
I don't think I knew a single economist who knew what the SIR model was. And thankfully, it's a mathematical model.
Payment to household available either via bank account or via electronic money on people's cell phone, etc. It would have been easier to activate.
My hope is that with this pandemic, that there will be this will trigger a shift towards making not just a more prosperous economy, but more sustainable in terms of inequality, but also in terms of greening the economy.
What scientists tell us, it happens. And sometimes nature is stronger than us. We are lucky to be able to deal with the vaccine, maybe. Climate change is not going to be addressed with the vaccine.
If the vaccine is effective, will we bounce back? And as Jeff said, we've got a long way to go. And these scarring effects might hold us back.
Never again like COVID-19. We can and must do better to identify the next health threat.
We said that during the Ebola outbreak in West Africa, that never again would we be in that situation. So we really did learn a lot.
It's a huge effort to establish many of these surveillance and information systems that we might be talking about as being elements of preparedness. But then they tend to get neglected once they're established, so that different skills are needed. From the establishment of these institutions to then making sure they continue to function effectively. And I think that's a major issue of accountability and measuring continued effectiveness.
That we need to embrace a new governance, pandemic governance structure to empower WHO, strengthen it, but very importantly, empower it. And I underline the word empower.
I think we need to recognize, as I say, the different types of misinformation, the different types of uncertainty, and not just try and have a blanket approach.
So that means that we have to start off by developing an architecture for data that suits a region or a continent like Africa.
How do people develop trust in them as a communicator, or do we find the people who are trusted?
If we have timely information, accurate information, and truthful information, then you can engage with the community.
Recover in a way that does not exacerbate health, economic, and social inequality.
We have to use a multidisciplinary approach, which means if we are going to go to country X or region X to fight these diseases, we have to have behavioral scientists. With us, we have to have people who understand how to engage with the community and get them there. Otherwise, we find ourselves in this whole concept of the value of debt, where you have the products and you can't use it actually in the community.
So it's a huge opportunity to make a step change in public health preparedness. In research, this should stimulate a major step towards genuinely multidisciplinary perspectives. And in that respect, I hope this will become a major role for J-IDEA. Thank you very much.
I couldn't have imagined being where I am now a year ago. What was most surprising, unexpected for you?
The most surprising thing for me has been the absence of global coordination and political leadership on what is an unprecedented crisis. I mean, the biggest challenge that government has ever faced. You've got to get really organized as a government, and one of the hardest things is not taking the decision, but actually identifying what the decision is. It's not a question of the economy or health. You've got to balance the two, because there are also other health aspects. For governments, this is such a difficult question, because you will always get punished as a government for acts of commission, but acts of omission tend to get less punished. What you're going to find is that many of the social concerns, inequality, income stagnation, I think you're going to find all of those things back. but with a vengeance and very, very strong. And that's going to pose a real challenge to policymakers in a constrained fiscal environment. A whole lot of things that people did or started during lockdown, like remote working, some of that is going to continue even after COVID ends. And I think one big thing, which is a challenge and an opportunity, is that the adoption of technology is going to be accelerated. People have learned during the course of this crisis that with technology we can do a lot and we can do it differently. And that is going to be a challenge because it will mean some jobs get displaced, but it's going to be an opportunity. The important things about your institute, but also other similar types of initiative, and there'll be more to come, I'm sure, afterwards, is if we did this on a globally coordinated basis, think how much better we'd be.
Although this has been a remarkable year for the Jameel Institute, I know the team will match its efforts in the years ahead as they continue to grow in the world leader in evidence-based health policy making.
Can you tell us your vision for J-IDEA?
Well, following on, really, it's all about emergency preparedness going forward, working with our partners to make countries more resilient to dealing with crises, not only on infectious disease outbreaks, but going beyond that to other crisis situations that have grave public health impacts, such as armed conflict, environmental disaster, but then also more long-standing crises related to climate change and to the rise in non-communicable diseases.
I think that this is the time for J-IDEA to expand its footprint through emphasizing even further the importance of building capacity, as we've seen with the COVID crisis. It's so important that countries, all countries, but certainly also resource-constrained countries, have capacities in terms of people, in terms of data, and in terms of institutions and systems.
With its focus on cutting-edge methods, capacity development with a focus on emergencies and health system strengthening, to actually look at how infections interact with chronic conditions.
One, I think we can build really strong partnerships with those in positions in low-income countries who are wrestling with these difficult questions. I think there's a real opportunity for capability building and mutual learning through those partnerships, and I really look forward to that.
So I think that drawing together of engagement with the public with actually doing empirical research is a bit of the centre that is my passion, if you like, to bring those things together.
So a place of exchanging and generating ideas around data and around methodology for better health.
Many, many thanks to all of our partners we work with and the funders, which are many, but particularly Community Jameel. And many thanks for the speakers and facilitators in this symposium. I hope everybody found it interesting.
Thank you all for making this symposium such a high quality and intensive conversation.